Today I'm going to talk about the role of wildlife disease surveillance and how it could advance One Health. So how I want to kind of go through this talk is first discuss what wildlife disease surveillance is, discuss the CWHC because many of you may not be as familiar with us, and then I have 4 examples of diseases and how they are related to One Health in general. So wildlife disease surveillance, so I'm a bit biased. I'm going to say it's extremely important, and I think a lot of people do agree with me on that. And the main thing that I see as important for this is that regardless of where you are, we are in contact with our environment, with the wildlife that are within it. Depending on what you do, obviously your risks are going to be different. So if you're somebody like me who works in a lab with a lot of wild animals, then I'm going to be at a higher risk than somebody that, say, works in an office. But there are other people out there. There's wildlife rehabilitation centers. There's a lot of researchers that work with wildlife. But it's not just them. Everybody's in contact with wildlife on a daily basis. Depending on where you live, it could be an urban environment, so you might come in contact with squirrels or songbirds. In rural environments, maybe it's more raccoons or coyotes or other species like that. So with wildlife disease surveillance, I'm going to talk about the active versus passive surveillance systems and how they actually work. I'm going to do this in a very generalized aspect. For me, active surveillance is more kind of on the research side of things. So when I'm talking about active surveillance, I'm talking about actually looking at a specific disease or specific problem, going out into the field, actually collecting samples from live wildlife, looking at the entire population, live animals, sick animals, dead animals, all ages, and specifically targeting something for those animals to investigate. That can give you a more accurate picture for prevalence because you are going out into the environment, you're looking at all of the age categories, looking at all of the potential animals that are out there. But to do that, it's going to be a lot more costly. It's going to take a lot of time. It's going to take a lot of resources to actually get out on the landscape, take all those samples, get them back to the lab, and then test them. So on the research side, that works very well. When we're talking about wildlife disease surveillance as a whole, it's going to be a bit more difficult to do it in that respect. So often we rely on what's called passive surveillance. And with passive surveillance, what we typically do is we're waiting for the public to report cases to us. So when an animal dies out on the landscape, somebody at the public will find that animal, they can contact us, we can work with them to get the animal into us for testing. Obviously, there are issues with that, but it is a much more cost-effective way to perform wildlife disease surveillance. Some of the challenges that come with that, this is wildlife, and anybody who's worked in wildlife knows that there is basically no money associated with it. On the human health side, agricultural side, lots and lots of money. Wildlife side, we're still working to get funding towards it. It's slowly improving. Unfortunately, as we deal with more and more diseases that come from wildlife into humans, the funding does go up as people recognize the importance, but for now it is still extremely challenging. And the other thing that, as you can see from this map here, so that map that's shown on the screen is basically our cases that have come through for the first 6 months of this year. So all of those purple and green dots that are on that map are where our cases are coming from. And you can already see that there is a bias here within this province in that we are taking most of our samples from where there are humans. So Southern Ontario, Eastern Ontario, high human population, a lot of people available to report it to us. We're going to get more animals from that area versus Northern Ontario, where we only have scattering of remote communities, not as much of a human population, or if they are up there, they may not know who to contact if they do find a dead animal. So there is some biases with that, and there's also logistics when we're dealing with Northern Ontario, because trying to get an animal from a remote community is much more challenging than getting an animal from Toronto or Ottawa. And then the last thing that can be a challenge for us is that we have to rely on the public. So people have to know to contact us, which up until avian influenza hit, that was a much harder thing. So I want to go over who we are at the CWHC next. We are a cross-Canada network, so we're based out of the veterinary colleges and the BC Animal Health Centre. So we have 6 regional centres across Canada. Those red dots show where we are located. As you can see, it's going to be more in the southern aspect of the country. Again, the population is going to be what impacts where we're located as well. And as was mentioned in my intro, for our region, we actually cover Ontario and Nunavut. So at the University of Guelph, we're expected to then do wildlife disease surveillance for a large province and a huge territory, which can be a big challenge. I don't want to go over our mission and purpose, but I just want to note with this that One Health is something that we've been thinking about for many years now. And it is in our mission statement that we are looking to work with people in agriculture, in public health, in other disciplines to try and bring everything together as a whole. As for who actually works for our region, again, because we're dealing with not much funding, there are 5 total people who run our region. And realistically, it's 3 of us who run the diagnostic service here at the university. So I'll start with Claire Jardine. She is our regional director, but Claire is a faculty member for OVC as well. She runs our wildlife research lab, so she does not have a lot of time to work on the diagnostic side of things. So we rely on her to kind of head the ship, get grants and funding available for us so that we can perform our work and then perform the research side of things. So she definitely is helping out kind of in the background to support us. Lenny Charos is our biologist. He also works kind of more on the research side. He does support us on the diagnostic side with helping with our tissue bank, as well as doing some of our rabies testing. And then when it comes to actually who does the diagnostic service, there's myself. I'm the lone pathologist, so any wild animal that dies in the province that goes for a necropsy, which is an autopsy on an animal, it comes through me, and I'm the one who examines it. And then we have Laura, who is our technician. She's going to be assisting me down there as I collect samples, and she's also doing all of the database entry for us so that we have this complete picture in our database. And then in the bottom right is Jenna, who's our communications coordinator. So if you are ever reaching out to us to potentially submit an animal, Jenna is going to be the one that's going to assist you with that. But realistically, for our region, it's myself, Laura, and Jenna that run the diagnostic service. So that just gives you an idea as to the type of funding that we're dealing with, that realistically we can only support a few people to run our system. And what we do on a regular basis is this wildlife disease surveillance. So that's what I'm going to be heading while I'm at work. So I'm going to be examining these animals, determine the cause of death, choosing different agents that I want to test for, different toxins, just to try and determine either why the animal died or what it was exposed to in the environment. So we do have specific diseases of concern that we are monitoring, that we will test a lot of these animals for. And then in addition to that, Claire runs our wildlife research lab. So she's going to be working on investigating different infectious agents, toxins, other threats to wildlife health that are out there. And we also work with a lot of different agencies. So we do work with a lot of people in agriculture, within public health. It's not unusual that samples that I take in my lab in the postmortem room are going to somewhere like Sunnybrook Hospital, to a research lab to perform testing there. So we do work with a lot of different people in different sectors. So I'll jump now into the main part of my talk, which is going to be about select wildlife diseases and how they could impact One Health. And when I think about One Health, I've kind of left out some of it in that I've left out the environmental side and a few other things. And I'll just focus on the vertebrate organisms for now. But when I even think about it, even though I am a wildlife pathologist, I often don't think about what are the impacts on wildlife, and that's something that I think a lot of people don't think about. They often think about One Health, how does that impact humans, how does that impact agriculture, how is the wildlife associated with that? But we also have to look at the wildlife and look at what is that going to do, what is that disease going to do to the wildlife populations, because we do know that as you affect biodiversity, that can lead to other diseases that could become more prevalent, more dangerous towards people. So we do have to look at the wildlife side and remember that biodiversity is important, and we need to recognize how these diseases are affecting our wild species as well. So the first one I'll start with is COVID-19. So everybody thinks of this as mainly a human disease, and I'm not going to focus on the left side of that screen with the bat moving the virus into humans and how there may be spillover between those species and other animals like that. I'm going to be focused on Ontario species here, white-tailed deer. I could also talk about things like mink, domestic cats, other species like that, because we have had infections in those species here. But I think white-tailed deer is a good one because not a lot of people were expecting this when it came up with COVID-19. So when this virus first hit, obviously there was a human health concern, but people on the wildlife side also had a concern because this did pass from bats to people. Was there going to be an issue for our North American bat species because they have been impacted severely by white nose syndrome? Could this virus jump back into our North American bats and cause more issues for them? Luckily, when they did the research, they found that the receptors that our bats have were not going to be ideal for the virus to attach and infect those bats, so there was less of a concern for our North American bats, thankfully. But they did find a few species where SARS-CoV-2 did seem to invade their cells quite readily. White-tailed deer was one of them. Nobody knew what those impacts were going to be until there was a group that actually did do infection trials within white-tailed deer. And they were able to find that these white-tailed deer could not only be infected by this virus, but they could spread it from deer to deer. And it wasn't just by close contact, they were able to also show that it could be spread via the aerosol route, similar to how it's spread in humans. So with that, they knew that this virus could A, infect the deer quite readily, and B, be able to spread from deer to deer. The good news for this is that it wasn't causing severe disease in our deer population, so they were mostly subclinical when they were getting this disease, maybe very minor respiratory disease, but in general, not really affecting their health overall. But again, just knowing that they can be infected in the lab doesn't really mean much for our wild populations. But research started to come out kind of at the end of 2021 that started to look at whether or not wild white-tailed deer were being infected with SARS-CoV-2. And the first paper that came out was from the US, and they found that both active infections and antibodies suggesting that these deer had been exposed to the virus was relatively common in the white-tailed deer population out in the wild. In some regions, it was as high as 30 to 40% of the white-tailed deer had been exposed at some point. So based on that, we started to look at white-tailed deer in Ontario and Quebec and did find similar numbers, not quite as high, but we did see evidence that our white-tailed deer were being affected by this virus as well and being exposed to it. Now, the concern with that is that, yes, it's getting into white-tailed deer, but anytime you get a virus into another species, there's always a chance for mutations. And if that virus were to get back into people, what does that mean for us? Does it mean that the virus is more virulent? Is it going to cause more disease? Is it going to change at all? So there was a bit of concern about what that meant for humans. Thankfully, up to this point, there really hadn't been any evidence of infection from deer to humans. But that did change because what the same researchers here in Ontario were looking at was which strains were actually circulating in deer. And they did find that there was one specific strain that seemed to be infecting the deer themselves and circulating within the deer populations. And it was distinct from the ones that were circulating within the human populations. And then when they looked at the public health data, they did find that there was one person that had been infected with the virus that had been circulating in deer, and this was after they had already seen it circulating in the deer population, so it was evidence that that person had actually been infected from a white-tailed deer. So it did jump from humans into deer and then back into humans. So luckily in this case, there wasn't any major change, but that is something that a lot of people are always looking at because there is the opportunity for these viruses to jump from species to species, and it can change them quite a bit and potentially increase the virulence and increase the danger for us if it is able to do that at high levels. But it wasn't just deer that were being affected. So a recent paper looked at exposure in a lot of different species, and they found that many different urban species, including deer mice, opossums, raccoons, red bats, cottontails, had also been exposed to this virus and infected by it. They did find that the seroprevalence was higher in areas with high human activity, which makes sense because obviously the more humans, the more opportunity to jump from human to wild animal. So this is just a good example of something where we kind of think of this as a human disease, don't really think about the implications for other animals, but it obviously is moving from humans into wildlife. Thankfully, we haven't seen any major concerns with this to this point, but it is something that people are continuing to monitor because at any point this could change and that we could see jump back from animals into humans and potentially have a different strain of COVID that could be more dangerous for us. West Nile virus is a disease that showed up in 2002, and I mainly want to talk about this one to discuss a little bit about how this virus is actually surveilled by public health in different regions across Canada, because it is slightly changing depending on where you are. And I don't know where it's going to go from here. But this is a disease that mainly affects some of our wild species. Corvids, crows and ravens, are highly susceptible to this virus. Our birds of prey, so hawks, eagles, owls, turkey vultures, also susceptible to it. And when we get on the non-wild side, horses and then humans are also highly susceptible to severe infection. We do get cases across the province. Wherever there are mosquitoes across Ontario, we probably do have some West Nile virus circulating out there. So there are a few different ways that this virus is surveilled in the wild. One is with wild birds. So with us bringing in crows that have been found dead on the landscape, these can act as an early warning indicator. So we will get these crows dying much earlier than we see human cases or even detections within the mosquito pools out there. So we can give you an idea as to where this virus is much earlier than most of the other methods. Mosquito pools is very good because it can give you a sense for what the risk for human infection is, and help you predict kind of where that virus is going to spread and where it's going to be a major concern for public health. So I looked at kind of what has been done in other regions. So other people have looked at the wild bird surveillance, they've looked at mosquito surveillance, and they've looked at things like sentinel chicken flocks. So one of these papers did look at them and did find that a combination of the wild bird surveillance and the mosquito pools did allow for detection of the virus about 2 to 5 weeks earlier than was seen with the sentinel chickens. And the other thing that they reported on was, and it shouldn't be a huge surprise, but when it comes to cost efficiency, testing the dead birds is actually a very cost efficient way to do it, because it doesn't take a lot of resources. You rely on the public to report it, you get the bird in for testing, you can do a quick swab, do a PCR, and get a result relatively quickly as well. So it is a very cost efficient way of doing things, but I don't know how well it's actually utilized. Right now, how we work with it is that anytime we get a West Nile positive bird, it is reported to public health. That goes out to the individual public health agencies. They will sometimes alert the media, so that's what these articles are about, is just people getting information about crows that are testing positive in their county relatively early on. This one on the left is from kind of early June, and then the other one's from late July. So when we're getting these samples testing positive, then it is being reported out there. But when I actually look at the public health website, so that's what I'm showing you on the left, is this is Public Health Ontario's website here. Those green circles are their mosquito pools, and then the blue counties are human infections. So they don't actually report on their website about any sort of wild bird surveillance. They will take that data in, and that could change where they actually set up their mosquito pools and look for evidence of it. But as of now, they're not using any of that data in kind of a risk assessment, at least in the public-facing way. That is different with Saskatchewan, who I talked to my colleagues, and they just started this work with public health out there, where what they actually have started to do is work on wild bird surveillance. They also look at environmental factors like heat in the region, because that can affect mosquito populations. And then they also look at horse cases and human cases to kind of give an overall risk factor for different regions across the province. So what this is showing on the right side here is that you've got these red, more high-risk areas, and that's because there have been wild birds that have tested positive in that region. There have been horses that have tested positive, and potentially humans that have tested positive as well. And they kind of set it up so that they can put out these bi-weekly reports, letting the public know where these high-risk areas are and what precautions that they can take. So I'm interested to see where this goes, because this is very early on. I think this is either the first or second year they've been doing this out there. But that may give a better indication for the public, if they are concerned about West Nile virus, when the risk is going to be highest in their region. So the third disease that I'm going to talk about is one that, even though I do just a little bit of testing on this, I can't really do a One Health talk and not discuss rabies at least a little bit. So for our lab, we actually just do testing on bat species. Any sort of terrestrial species, we will take the samples and send to the Ministry of Natural Resources, and they will do the testing on it. But we will just test bats, and the only bats that we will test are bats that have not had contact with humans or domestic animals. Because if it is a bat that had contact with either a human or domestic animal, that is a much more severe issue. So that is going to go directly to the lab in Ottawa for testing to get results immediately. And when people think of rabies in general, they think of rabies as just a single virus, not really much more than that, but there are different strains of rabies that circulate within the wildlife. So in Ontario, we actually have 3 separate strains of rabies virus. We have a bat strain that is basically spread across the province. Wherever there are bats, there's potentially rabies associated with them. We also have an Arctic fox strain that, not surprisingly, is going to be circulating further up north. And then we have a raccoon strain that circulates kind of in southern Ontario. With that, you can actually control for rabies in wildlife to a certain degree, especially for the Arctic fox and the raccoon strains, and that is by using these oral baits. So those are baits that have vaccine within them. They are going to be picked up, eaten by raccoons, skunks, foxes, and vaccinate that animal against rabies. This has been quite successful in Ontario and has led to a severe decrease in the number of rabies cases in our wildlife, as well as in humans and domestic species, specifically for the fox and raccoon strains. Again, the bats aren't going to fly down and eat that, so you can't really control for the bat strain this way. This works very well for those 2 strains, and it works very well in a small geographical region. So in southern Ontario, eastern Ontario, works great. We can definitely put those out. They can be dropped from a plane. They can be placed if it's in a large population area. But if we're talking about northern Ontario, that's just too great a land mass to actually cover. So it's not something that's feasible across the entire province, but in high population centers, it does work very well. You may not know that we have occasional rabies cases pop up here in southern and eastern Ontario. It doesn't happen too often. Most of the time it is bats that are popping up positive. But we do occasionally have cases in other species. So we did have a case in a young fox kit this year in eastern Ontario. It was found to be acting abnormal, brought to a wildlife rehabilitation center, seen to have neurological signs, and was having seizures, was euthanized, brought to us. We sent the sample off to the MNR. It tested positive for rabies. It was the bat strain of rabies, so this fox had likely been bitten by a bat at some point. So the MNR didn't need to respond to that because it wasn't the raccoon or the fox strain. But we do occasionally get these terrestrial species pop up with rabies, and oftentimes it is the bat strain because that's the main one that circulates here in Ontario. But we do have the other strains occasionally pop up. So on the right there, that article is talking about a few different cases of red foxes that tested positive for rabies up in northern Ontario in remote communities. And this was the Arctic fox strain because, as you can imagine, they're going to be coming in contact with Arctic foxes up there. And unfortunately, in those remote communities, it is much more challenging to control it. And we also have issues because there's not as easy access to healthcare for humans. There's not as easy access to veterinary care for the dogs that are up there. So there has been a lot of collaboration over the past year amongst the Ministry of Health, OMAFA, MNR, and others trying to get that support to these remote communities so that the dogs can be vaccinated up there, that there is post-exposure available for humans who have been in contact with these foxes as well. Just to give you an idea as to where these viruses circulate in Ontario, so this map on the left is from the MNR. These gray diamonds are the fox strain. All these green dots everywhere on both maps are negative cases. So you can see just north of us that we did have the Arctic fox strain circulating in northern Ontario or in southern Ontario. But the last case of that fox strain was detected, I believe, in 2018. So it's been a number of years since we've had that strain in southern Ontario itself. As for the raccoon strain, So this map on the right, you can see all these gray circles, quite a few raccoon strain animals down in the Niagara and Hamilton region. I believe it was suspected that this virus actually came up from the US at around 2014, 2015 back into Ontario. And then I can't recall if it was 2015 or 16 that it was first detected in a raccoon in Hamilton. But that kind of led the MNR to respond at that point, putting out those oral baits, trying to then squash raccoon rabies in that region. And they've done quite a good job. You can see there are a number of cases there, but those are from early on during the outbreak. There hasn't actually been a case since 2023, and the last one was, I believe, a skunk in Niagara Falls region. So it's been a couple of years since we've seen a raccoon strain in Ontario as well. So that's something that we are keeping an eye on. The MNR is doing constant testing. And again, any raccoon, fox, skunk that we have come through, we take samples and it's tested for rabies as well. For the bat strain, this is our data. So the red circles are positive cases. The yellow, white ones are negative cases. And you can see that it's basically spread across southern, eastern Ontario. This is just for 6 months of this year, but if I were to show you a map of the last 10 years, it would just be spread all across any area that we get cases from, because wherever there's a bat, there's potentially going to be the bat strain. So that one we're not going to be able to control as well. That's one that we basically just have to educate people on, if they do find a bat in their house, what to do about it, who to contact in those cases. So the last disease that I want to talk about is avian influenza. This is the big one for us. This has easily tripled our caseload over the past 4 years. It has allowed people to recognize that we are available for this wildlife disease surveillance testing, which has been good news, but it's been a lot busier for us because of it. One thing I will mention is that you may see these terms highly pathogenic versus low pathogenic, and that is specifically how these viruses affect poultry. So it has nothing to do with humans, has nothing to do with wildlife. It is specifically, if it's highly pathogenic, it's going to cause severe disease and death in poultry. If it's low pathogenic, it's likely only going to cause very minor disease or no disease in poultry. So this H5N1 virus first was detected in North America in Newfoundland in December of 2021. Soon after that, it spread across the continent along the flyways. But we did also have multiple incursions. So not long after those Newfoundland gulls were detected, there was a bald eagle out on the west coast that had H5N1, and it was determined that was a separate incursion that had occurred. So this virus has come in multiple times into North America from Europe and Asia. One of the main differences between this virus and previous avian influenza viruses is that it actually is causing severe disease and death in our wild population. So typically avian influenza viruses, they are carried by a lot of our dabbling ducks like mallards and teals, and they don't usually cause severe disease in wildlife. Usually it is just carried by them. If it gets into poultry, it could mutate and cause severe disease and death in the poultry, but in wildlife, they typically don't do a lot. This virus has been different in that it is causing severe disease and death of many wild species out there. And on the agricultural side, it is causing huge concerns for economic reasons. So in the US, just from compensation to poultry farmers that were ordered to destroy their flocks, it's cost the US over $1.4 billion to this point. In Canada, they estimated in 2023 that it's been over $100 million in compensation alone. And there are other factors beyond that. So it's been a severe disease for many reasons across the world. When we have infections, it is pretty much spread across the province. We had a particularly bad winter this year with this virus, where our resident geese populations did have severe disease and death across southern Ontario. So all of those red dots down there, a lot of them are from January, February, when we had mass mortality events in many of our waterfowl species. So pretty much it is spread across the entirety of the province. That's the main thing when anybody asks me where this virus is and where it's going to pop up next. Your guess is as good as mine. Watch the flyways, watch where birds are moving, because it's going to be where the birds are. As for who is actually affected by this, so waterfowl are severely affected by it. I see it most commonly in our Canada geese, partially because Canada geese are a very common bird out there on the landscape, and they tend to be more susceptible than mallards, which are the main host for this virus. But we do see it in other waterfowl, other shorebirds, especially birds that do nest in large colonies. So animals like terns, pelicans, gulls, cormorants, all of them, we will see outbreaks in them because they are nesting in these large groups. We also see in other species such as birds of prey and other scavengers. So turkey vultures, bald eagles in particular have been severely affected by this here in Ontario. And we also see it in mammals. I see it most commonly in red foxes, but we've detected it in many different species, including raccoons, opossums, feral cats as well. On the domestic animal side, obviously poultry is a big concern. We haven't seen it yet here, and hopefully we never do, but in the US they are dealing with an ongoing outbreak in dairy cattle across the US, and they are continuing to see cases pop up in different farms. Unfortunately, here in Ontario, there was one dog that did die from it. This was a dog that was seen to be chewing on a dead Canada goose, and it developed symptoms a few days later and unfortunately died. We got the goose in for testing, and the CFA was able to confirm that it was the exact same virus that this dog had. So it was pretty clear where that dog got it from. And then I mentioned feral cats, and this has been detected in many cats across the globe as well, because they are going to be out in the landscape. They're going to be out there in the environment, potentially scavenging on these dead animals as well. So what are the concerns when it comes to AIV? So if you look at the three areas that I've talked about, we'll start with agriculture. Obviously, huge agricultural loss is a concern for many people, farmers specifically. But when you are killing that many chickens, you are going to see changes in the cost of the goods that come from those animals. So in the US, they have seen a huge increase in egg prices over the past few years as a direct result of this virus. We haven't seen that as much in Canada because we do have this supply management system. So our costs haven't been affected as severely, but it is a huge concern for a lot of people worldwide when it comes to this disease. On the human side, there haven't been many cases. There have been a scattering of human cases. Rarely it has been fatal, but there have been a few severe disease cases in Canada as well. And depending on who you are, your risk is going to be different. So obviously somebody like me working with these animals on a daily basis, wildlife rehabilitation centers, poultry workers, all of them are potentially going to be at a higher risk. When it comes to hunters, there is some risk there, but they are often hunting healthy animals. So their risk is actually a little bit lower than somebody who's going to be working with animals that are actually sick from this disease. And prior to COVID, whenever anybody talked about a potential global pandemic, avian influenza was always brought up as the first possibility because it has that potential. Birds move everywhere, they move across the globe. There is that potential to move into humans. So far we've been lucky, and this really hasn't jumped into humans all that much. But a lot of people consider us in the pre-pandemic stage of this virus because at any point it could jump into humans and start spreading. And then on the wildlife side, I've talked a lot about Canada geese as the main one that I've seen affected. Probably not a big concern for population levels of Canada geese, but there are animals out there that are at risk. So there have been reports recently of whooping cranes that have been dying of this virus. So there was one in particular that's got a lot of press. It was in a wildlife refuge in Wisconsin, and it was part of a breeding program, and it died of avian influenza. There have been concerns for some of the free-ranging whooping crane populations in Canada and how much they've been affected by this virus to this point. One that I haven't seen a lot about yet, but there is a lot of concern for them, is the California condor. So that was a population that was devastated by DDT back in the 60s and 70s. Their population has slowly been rebounding, but that is a species that does scavenge on a lot of animals. So it has the potential to cause severe population impacts on some of those groups that are at risk already. So it is a disease that a lot of people are watching very closely and trying to figure out what they can do for cases like this. If you do have an endangered species in care, is there potential when there is a vaccine available for birds, could you vaccinate those animals? That is something that's been done with a lot of different species for different diseases. So there is a long list that I could have talked about today, so I picked out just 4, but there are many other diseases out there that we could have talked about, and I'm happy to talk about some of them if anybody has questions about them. But they do have impacts on potentially different aspects of One Health, whether that is the agricultural side, the human side or just a biodiversity concern with things like chytrid or white nose syndrome. At the end of every talk, I always put a plug in for CWHC, just because we always want people to contact us. So if you do find dead wildlife out there on the landscape, there are multiple ways to contact us. We don't necessarily bring in every animal, so if it's hit by a car or something, we're not going to bring that in because I don't need to look at that animal to tell you why it died. But we do have toll-free number, email, online reporting. If you just Google CWHC, you can find all of this contact info as well. But yeah, I'm happy to answer any questions that anyone has. And yeah, thanks for having me today.